Yes, this is a learning lunch. It's all about a case study. We've got Ashish Singal with us this afternoon. Thank you very much, Ash. Ash is actually in Florida at the moment, so again, extended thanks for joining us today. Really appreciate it. But I've got a couple of quick slides, and then we'll hand over to Ash to be able to demonstrate and talk about the emergency department app at Dudley Group. So just bear with me. So I say my name's Chris. I've been in the industry for about 20 odd years now, producing digital content in some shape or form. Worked for the NHS for 10 years, creating online learning content for colleagues, created apps, managed the intranet and the internet, managed Twitter feeds and LinkedIn groups and all sorts of different stuff. So fairly well versed with digital media and the NHS and kind of how it works. But at my heart of hearts, my passion really is about making it easy for people. Really interested in just trying to increase efficiency by providing people with digital tools to be able to do their jobs sort of more effectively. I always thought that, you know, if I can save people time using digital, they can spend more time probably doing the job that they signed up for, which was, you know, looking after people. So Piotr, we've been in the healthcare sector for about 3 years, relatively newcomers in terms of time, but we work with over 80 different teams now within the NHS. Right at the very top, we work with NHS England and NHS England and Improvement, Public Health Wales, lots of different hospitals, STP, CCGs, down to department and team level, as we'll explain today. We have an app solution. It's very much a template-driven solution we can license to you. It comes in 2 parts, the app itself and then a content management system that provides you or your team with access to be able to maintain and update the content on your app. So all of our apps look very familiar. Top half of the screen, there'll be a logo. Bottom half of the screen, we've got this 3x3 grid, which we call the tiles, but essentially it's your menu system. And behind those menu systems, you can create lots of sort of various different bits of content. So we've got functions around calendars, about contacts directories. You can make links to portals and web pages and different apps. So there's a whole toolkit behind these different tiles and these different functions that allow you to produce apps either for your colleagues or for patients. You know, we do both, and we've got lots of examples of different apps we've created for different organisations that we could share with you. So we want to do a little bit of an overview of what Ash and the team are doing at Dudley. But beyond today's presentation, if you've got questions, if you'd like us to talk about, or if you've got ideas about apps, just reach out to me directly. I'll share my details later, and we can kind of show you what we do and how we do it. So for now, I'm going to over to Ash. Ash, thank you very much again for helping us out. Really appreciate it. And Ash will talk about the emergency department app. Thanks, Ash.
Thanks, Chris, and thanks for inviting me to present. My name's Ashish Singal. I'm an ED consultant in Dudley in the West Midlands. And I got interested in this app about a year ago because I was just frustrated that, you know, yes, I know we've all got our intranet, but it's so frustrating finding information for our department sometimes. And so, the concept was to have everything at your fingertips in one simple app. And so what I'm going to try and do is I'm going to try and demonstrate the app. Now I'm sitting in Florida. I'm hoping this works. So I'm going to try and live off my phone. If that doesn't work, then I might have to revert to PowerPoint. So just give me 1 second. So hopefully, yeah, you can see my phone there. Okay, so it is as Chris says, an app. It sits on your phone, and let's face it, every single one of our members of staff have got a computer sitting in their pockets, and they're so used to using these nowadays. So this is the emergency department app here at Russell's Hall. And essentially what I've tried to do is just bring everything into one place. And I'll try and get through as much as I can. There is a lot of content here, so I'll try and get through as much as I can. So firstly, it's about the clinical stuff. You know, have all the clinical information at your fingertips. So if you press on the adult guidelines there, we've uploaded all our adult guidelines into the app. And so if I wanted to say I was standing in recess and I just forgotten one of the algorithms, they're there at my fingertips. So as you can see, we've uploaded all the recess guidelines there. We've got things like alerts. If there's any specific alerts come out, I can put them straight onto the app. And the minute you update the app in the dashboard, it is immediately available to everyone. All right, so the app will update itself live. All right, so we've got information about COVID. We've got our ED guidelines in there as well. This content is being built on. So we've got medical guidelines, orthopedic guidelines, obstetrics, plastics. As you can see, you can just add more and more stuff here. It's unlimited what you can do with the clinical guidelines. I've done the same here for pediatric guidelines as well. And you're seeing this as fast as it actually happens on the app. All right, so there's actually no delay in the system. If I want my anaphylaxis guidelines, there is in pediatrics, straight away they're available to me. Now the big advantage is if I'm sitting at home and someone asks me a clinical question when I'm on call, I've got all those clinical guidelines at my fingertips as well as the staff in the department. And you can say yes, they've got the intranet, but the problem is it's so frustrating trying to find the right information. There's so much information on our intranets that you're not quite sure what is in date, what is out of date. That's the clinical side. From a governance point of view, we've uploaded all the trust guidelines, and I can go into the trust guidelines and open the trust guidelines again, and you can upload PDF documents. You can upload pictures. We've got our department sickness policy, so whenever a member of staff is going to be sick or off sick, they've got the full policy in the guidelines. We've got our ED handbook in there as well if they need it. We've also put in our passwords as well, and I shouldn't be showing you that. So we've got our passwords. As you noticed, that a lot of these things have a padlock on them, and that means access to this content is actually by permission only. So when you register new staff, this is strictly staff facing. When you register new staff, they have to go through a 2-point authentication, which means they need to, first of all, give you the NHS email. And when they give you the NHS email, when they try and complete registration on the app, there's a 6-pin code that goes back to the NHS email, which they have to put into the app before they can see any of this content. And I'll explain how the content works later on. The directory service is great. Okay, so I now have the facilities that, for example, I can, or they can, you don't have to do this obviously. If they want to, they can ring me directly from the app. Okay, and what this does is it allows you to ring the switchboard, and after a very short delay, it will then ring the extension. So you can essentially put in any extension in the hospital, and they now have direct dial facilities to those. They don't have to wait for the frustrating switchboard to answer. Okay, so what we've done there is put in the numbers for various hospitals, and then if I wanted to ring majors, I can ring majors just straight from the app. Okay, that saves, little things like this just save people a lot of time. Alerts, we can send alerts out. So a lot of these are things that I've sent. So whenever you send any type of forms, that puts it into the alert section. But we had an alert come out about lamp testing, so all I did was upload that into the system. I minimized the amount of alerts we send out because I don't want to be intruding in people's lives. But the important stuff we can send alerts out to, and the facility, the benefit of that is everyone now, every single member of my medical and nursing and admin staff are now registered on this app, and I'm confident that they are getting these alerts because it comes to their phones. You also have a form section. And from here, we in our department, we do our handover. So we do an 8 o'clock, 4 o'clock, and a 10 o'clock handover. And what the staff do is they put in these details. Okay, and that alert, that handover sheet then comes into our emails, and then we forward that. We've set it up that way because what we do is we add a snapshot of our dashboard, and then we send that out to a trust as a SITREP report. You can create it in such a way that you can actually send a SITREP report to the trust directly from the app. Obviously, any of the content here you need to make sure that it's confidential So, I'll put them there at the top. Please do not include any confidential information. Our staff can also request annual leave on here. And each one of these forms goes to a designated person. So whereas the handover sheet will go to the ED consultant group, the annual leave request form goes to Becky, who is our rota coordinator, and she will then obviously sort out the annual leave for them. So the training side of it, this is unlimited. I mean, I could go on about this for half an hour. What we've done here is the trust mandatory training. I have put the trust mandatory training online now. So it makes life easier for staff to complete. Let's face it, they don't want to come into the trust and do any extra hours to complete mandatory training. So what we do is, as an example, so my new starters in December have all been put onto the app already. They've had access to this app for a month. And I'll show you that in a second, but the second part of this is we request that they complete their mandatory training prior to arriving in the trust. We give them the time back, but it just means they complete it prior to starting in the trust. We've got clinical education sessions. These are one-to-one sessions, which they can book directly from the app. I've put up their education programs. So for the HSTs, the EDST 4s to 6s curriculum is in there. The middle grade teaching program is in there. These are our trust grade doctors. Their full training program is in there. And as you can see, it gives you the date, who did the presentation, and the presentation as well. So they can link directly to the presentation. If they miss any of the teaching sessions, they've got access to the presentation. Okay, so as long as they send me the presentation, I can very quickly upload it into the app and they have access to it. So I've done that for all grades there. As you can see, I've got ECST 3s, junior doctors as well, training programs on there. What else do we have on here? We've got various textbooks, teaching about anaphylaxis. If you want to, you can also upload videos onto here. All right, how to set up an arterial line is in there as well. So as you can see, I have lots and lots. The chest X-ray one is about where to, how to read chest X-rays, and then various places where you can find education about reading chest X-rays. Digital nerve block, for example, is another video, and there's various ways you can do this. There's various videos there. There's lots and lots of education stuff. Yeah, so stuff that you find is actually good. So what I do is ask my staff for recommendations of what modules they found useful, and then what I'll do is upload it into the app for them. And it's very easy. And if I get a chance, I'll show you how easy it is at the end. Our next plan is to take our rotas online. We haven't got cloud-based rotas at the moment, so this just allows me direct access. I'm not going to open those contents. This allows me to, any of these rotas are available to me at my fingertips. You can have those as VO only, or you can have them as edit form as well. Useful links is, as it says, useful links to various websites. So just the general medical website, things like Medusa. Medusa have been great, whereas Medusa is username and password controlled. They have given us an individual link into Medusa, so I can actually link, or any of the staff can actually link straight into Medusa, and it opens directly. Okay, really, really useful. Talkspace again, we've got direct access into Talkspace as well. So that's useful links. So you do have 9 tiles, but you can add additional options. So if you open the menu button, as you can see, the 9 tiles are down the side there. So I got down to useful links there. Patient information. This is something I've done. So what I've done is essentially created links to the NHS Net, NHS UK website for the, they've got a lot of patient leaflets in there. one of the biggest problems we find with patient leaflets is just maintaining the content. So what I've done here is essentially created a QR code for the various leaflets. So this QR code will take you directly to the AAA leaflet on NHS UK. And the idea is I just flash this to the patient, I ask them to scan it, and when they scan this QR code, it takes them directly to the appropriate page. So we now have over 250 patient information leaflets, where, for example, in the epistaxis, we have both the NHS leaflet and a trust leaflet. I have put both, so the staff can do both. So you can actually, I can now again give them an electronic copy of a patient leaflet. What you do with this is essentially once they flash the QR code, you have the menu button at the top of everyone's phone, which allows you to drop that page onto their home screen. It's very simple, very, very simple to do. Where are we? Events calendar is just calendar, right? If I know about anything that is ED related, obviously the app is very ED related. For example, the stamp course, I can load up the information about stamp course. So again, as soon as I'm made aware of any type of educational program available, I'll stick it on the app. And again, that will be immediately available to the staff. This is the induction I was talking about earlier on. So my December starters, so they haven't started yet, they start in 2 weeks. I've been given access to the ED app. And what we do is we've just put our induction online. So they have 20 modules they have to complete before they start. Okay, so these lot will be starting on the 1st of December. So we have given them 20 modules to complete. They have a presentation to read and assimilate. And then we have a self-assessment as well. Okay, the self-assessment sits outside the app. This is using Microsoft Forms, but the important thing is it's all held in one place. So with this, it's again, Microsoft Forms is a very powerful tool. They will just answer the questions. So there's 40 questions. I'm not going to answer 40 questions there. They answer all the questions and they submit it with their name and email address. The form will then immediately mark itself because you put the right and wrong answers into the system already, and it will give them a result. And the idea is they need to score 80% on each one of these assessments to pass them. Okay. Again, we give them the time back for this when they start. But the most important thing about this is they come to us with the knowledge instead of us giving them teaching, say about abdominal pain 3.5 months into their 4-month rotation, which just seems a bit pointless. Okay, so this is part of the induction program for the new doctors. Okay, so at the moment they're just working through their content. I can see those results as well, so the results come back to me in a database. What else do we have? We've done the induction. News is not something we use. About us is something I'm just working on at the moment. And this is just putting a face to us. All right. So we've just started to upload pictures of ourselves and just a bit of information about who we are, what our bits and pieces are. So we're just doing that for that's the consultant body. We've got the middle grades doing it as well. And then I'm hope the admin team as well are starting to put up their content as well. And I'm hoping that some of the senior nurses will do it as well. It's just sometimes getting the information out of people is like pulling ants' teeth, really. So in summary, that is the app itself. As you can see, very, very simple. Chris, if it's okay with you, I will just quickly show them the dashboard.
Yes, please do. Yeah, absolutely.
Okay. So guys, I have an interest in IT. I'm not IT literate in any way. So the big benefit about the app, this is on my desktop, is the dashboard. The dashboard is just incredibly easy to use. All right. So as I showed you, the first style there was adult guidelines. And this is what the dashboard looks like. And it's very, very easy adding content to this. It's incredibly easy. So I said to you that the content is controlled. So you have these controls. I'm just going to minimize that. You have these controls here in the bottom right hand corner. So this is the corner. So this is the CPR guidelines I showed you initially with the flow sheets. So you can elect to have the access open to the public, general public, so anyone who downloads the app can see it. In my case, most of the content is actually to only registered staff. Okay, so any people who are registered to your app will see the content. You can break that down to individuals. So you can actually break that down to say just ED consultants will see this content, or junior doctors, or ED consultants and junior doctors, or you can break it down to an individual. So you can break the controls down to an actual individual, so only I can see. So some of the content in there is for me to help me run the app. So I've put that down to individual level, and only I will see that content. And that's how easy it is. You can put in publication dates, you can start publications and stop it presenting at any stage. And if you want to upload, download content, you either just copy and paste it into the box. You can link it to a PDF. You can add videos. You can hyperlink. Right. You can also add links to other documents as well. Right. So some of the content, some of my content sits in the cloud, and I've just linked that to the cloud content. The minute you change anything here, it changes at their end as well. So it's an instant thing.
That's great.
Okay.
So, thank you very much. That's been brilliant.
There was a lot of information there, guys. The app is so versatile. You know, I've had people asking me, well, why don't we create it in-house? I'm just thinking, you know, as at Trust, we've got so much more work we need to do. We are now paper-free as a department. And I have a fairly advanced digital department, but they simply do not have the time to do this stuff. So, you know, everyone can say, oh, yes, fantastic, we'll do this ourselves. Just two things. Number one is the manpower resources and the financial resources you'd have to invest are huge. It is not worth it. It's, you know, it's best to outsource this and let people like Chris and his team, or you know, to run this for you. Because it's a lot of work in the background. Oh, by the way, I have no conflict of interest to declare here, guys. I've got nothing to do with the company. I just work in the NHS.
Ash, thanks so much for that again. We've got a couple of quick questions, if you can just help us out with these. Shane,
Chris,
yes.
I don't know if it would be easier. I don't know if you want to just give a mic access, and I'm quite happy to take questions live.
Okay. I don't know if we can do that, but I'll just crack on. That's a lot of questions for now. So Shane asked initially about access to the mobile phones. Does the ED department provide staff with phones, or are you using your own mobile phones?
No, that is my mobile phone. I just dropped the app onto it. So when you
what about colleagues? I mean, do the colleagues have work phones, or is it the personal phones that they're using to access the app?
All of us are using personal phones.
Personal phones. Another question that came...
Sorry, Shane, if there's a follow-up question to that, is that an issue? Please just stick it on the chat.
Oh, the other question, or Shane's second part of the question, was about perception from about visitors and carers and, you know, people on the ward about staff actually using phones and being visible using the phones. Have you had any issues, you know, any feedback from people saying, well, why is that person on the mobile phone? And, you know, are you as an organisation using any communications campaigns to be able to highlight that, you know, we're actually using phones for work purposes, you know, we're creating efficiency, we're putting more time back into the system?
Yeah, Shane, I've had no issues so far. It's not been a major issue. You know, our staff are using phones on the shop floor. As far as I'm concerned, we're using this for the benefit of the patients. So I've got no issues. That question has been asked and it hasn't come up as an issue yet. But but I'm sure it may do. But as long as I'm happy that, as you can see, the page is very red, so it's quite obvious if they're on WhatsApp or on the app.
Yeah, I think it's a good point, Shane, that you've raised. And I think, as I say, I don't work for the NHS anymore, but used to. I think there is an educational piece there to sort of families and carers, just to let folks know that we are using mobile devices. We are in a digital world, and we're looking to increase efficiency using these devices. So quick poster campaigns or something of that ilk, being able to demonstrate why we're using them and the benefits it's bringing can't be a bad thing. Last question was from Esther, who's asked, have you had to come any technical issues with the app so far?
We've had some minor issues with the formatting. So, for example, the handover sheet, there was minor issues with the formatting. All I did was I dropped Chris in a line and said, Chris, there's an issue here with the formatting. Can you sort it out? And Chris and his team just had to go back and just they do the clever stuff in the background and sorted it out. And the relationship I have with Chris is great. I just drop an email or a WhatsApp message, and he gets it resolved fairly quickly. Not big issues. Other issues with the app? No, dead easy. When new staff are starting, I kind of pre-register them, and you can pre-register them with a file upload, which is essentially their full name and their NHS email. So that's a simple process to do. I can do 100 staff with a simple file upload, which I can do myself. And then they just complete registration. And as I said, the complete registration was a 2-point authentication, which is very easy for them to do. Simple instructions, hit the padlock, enter your email. And as soon as you do that, as long as you've been pre-registered, the system recognizes you and gives you full access.
Fantastic. Thank you very much for that. I'm just conscious of the time. We did say we'd sort of have half an hour, so I'm just going to plough through a couple of quick slides. Ash, thanks ever so much again. I know you're across the pond, so we do appreciate your help and all the nice words you said about us. Thank you again. So just a quick sort of follow on from that.
Chris, sorry, I thought there was one more question that just popped up there.
We'll perhaps come back to that shortly. So just want to talk a little bit quickly about the app. So POTUS actually stands for Put It on the App, and as Ash has very quickly very well demonstrated, it comes with a bunch of functionality that we can customise for your particular needs, whether it be staff apps for your colleagues, or whether it be patient apps or family and carer type apps. So we've got lots of different information on there that you can put on there. It's licensed on an annual basis, so it's not mega expensive either. Hopefully, Ash has been able to portray the quick and easy aspect of this. It's not meant to be overly complicated. It's not meant to be difficult. And same with the procurement process. It's not meant to be an expensive product. So we license it on an annual basis. There's an initial setup fee, and then we license you anywhere between £2,000 and £6,000 per year, depending on the amount of downloads. I think Ash talked about the dashboard. So as I say, there are two elements. There's the app itself that we can customize, and the dashboard. The dashboard provides you with an app analytics engine, so you can see how many people are downloading it. You can see what sections they're reviewing. So you can build up a bit of a heat map to what's hot and what's not. Again, if you're looking to be able to, demonstrate the effectiveness of the app, then you can use these tools to be able to do that. So what's the typical process look like? How do you get involved with us? What does, how quickly can we respond to you? So normally we'd get an inquiry from you guys, interested in doing this app, interested in doing that app. We can have a quick meeting. We can demonstrate various different apps that we've got for different organisations that will be similar. We can produce a free trial. So we can put something together, put some of your content in there, provide you with an app that you can take to your colleagues or your patients and start to evaluate it quite quickly. After a few hours, you'll kind of get the hang of it. There's nothing complicated in it at all. And then we kind of get the agreements set up, and we kick off the project. I've put some timescales down there, 8 hours. Oof, that can't be right. But we actually did one. I think at the start of the pandemic, we worked with a team in Wolverhampton, and they wanted to use the app to update all their care home managers and care home staff about the pandemic and everything that was happening. So we got a phone call, I think, early doors on a Tuesday morning, and by late afternoon we'd rolled the app out, and they were using that to keep in touch with all of their colleagues. So it can be really, really quickly and really, really simple. As I say, it doesn't have to be complicated. Get in touch with us, reach out, let's have a little chat, and we can produce you, very quickly a trial which you can then use to go and talk with your clients or customers, patients, whoever they may be. I think we have questions. There might have been one more question actually, just looking before we go. About, can this app be used offline? You need to obviously download it and install it first, and once the pages have been installed onto your phone, you can go back at any time. Things like the push notifications and the alerts, obviously there needs to be a live internet connection, but yes, once you've downloaded it, once you've viewed those pages, they remain on your device. So if you are thinking about using it online, what you need to do is download the app and look at the different pages that you need, and then off you go. So hopefully that answers that question. I don't know if Shane's got another question coming in quickly. No, thanks, Chris and Ash. Very insightful. No, thank you all for your time, guys. Ash, I don't know if you've got anything to add before we go.
No, guys. I think an offer from me. If you want, Chris, I'm sure this is okay. I've got nothing confidential in my app. If any of you want access to the app, I'm quite happy to register you onto our app. So for a week or so. So you can have a play with it. I think the best way to do this is you need to see it and then try it out yourselves to understand what the app is trying to achieve. So I'm quite happy to offer anyone access to my app. You can download it off your app stores.
I think Rachel there from Epsom has said yes, please, Ash. That would be brilliant. So
yeah. So guys, if you do me a favour, if you just put on the chat, if you just put down your name and where you're from and what your role is, and your email address, I will pre-register you. If you can, Chris, do you want to send them my NHS email?
Yeah, put your details in there. We can get that organised between us, can't we? I guess.
Yeah, we'll sort something out. I just need to confirm you work in the NHS first of all, guys, sure. Before I open it out to everyone. But it will be for a limited period.
So we've got some people responding already with email addresses and things. So again, thank you very much for your time today. I hope you found it insightful. We'll be getting in contact with you after the event. We have videoed this and we will send it through to you. So if you have colleagues that you think might benefit from watching the video, please do share it with them, and we'll be back in contact soon. But Ash, again, thank you very much, sir. Much appreciated. And all the best to everybody else. Thanks again for your time. Take care.
No problems. Thanks, guys. Bye-bye.